Good day, kids. Our topic for today is the first part of our research lecture, which is the discovering research, or we are learning basic concepts about research. The following are the objectives. Let's start with discovering research as introductory concepts. We have different concepts, such as definition of research. Research is a nursing is a very basic aspect when it comes to advancing our professions and improving patients' care. It involves a systematic approach when investigating a phenomena which is relevant to nursing practice, education, and administration. Nursing students may embark on research journey and must understand that research is not just about conducting studies, but also about developing critical thinking skills and a culture of inquiry. The purpose of nursing research extends beyond mere academic exercise. It aims to develop new knowledge, refine existing practices, and also inform healthcare policies. By engaging in research, nurses can contribute in the growing body evidence that these body evidences may support and improve nursing care across various settings. And there are several types of research that nursing students may encounter or conduct. These range from basic research, which is focusing on fundamental principles to a more applied research which addresses specific clinical problems. Those clinical research, educational research, and health system research are also common in nursing, in which it addresses different aspects of our profession. The research process typically follows a series of steps, beginning with identifying a problem or questions of interest, and this is followed by a review of existing literature, development of hypotheses, or providing research questions, and then designing the study, then collecting and analyzing data, and finally disseminating the problems. As we understand this process, it is very crucial for us students to this process will provide us a roadmap for conducting research and having a critically evaluating existing studies. We have such thing as evidence-based practice and this is a cornerstone of modern nursing. It involves making clinical decisions based on all best available research evidences, available clinical expertise, and patients' preferences. Nursing students should learn to investigate research findings into their practice, a skill that will be very valuable throughout our careers. That is our evidence-based practice. And we have to utilize the research. And this is closely related to evidence-based practice. By focusing or implementing findings from specific research studies into practice. And this concept emphasizes the practical applications of research wherein it bridges the gap between theory and practice. The ANA, or the American Nurses Association, define research a more comprehensive health focus. The ANA definition of research emphasizes a holistic approach wherein incorporating three main dimensions. uh, Number one, health promotion across the lifespan. Second, care management for health conditions. And the last one is nursing intervention for health responses. This definition uniquely addresses both preventive and reactive aspects of healthcare and highlighting our profession's comprehensive scope. Byrne and Grooves define different research as in a different perspective. Their definition centers on the scientific method's role in research, no, which emphasizing two critical processes. Number one, validations of existing knowledge, and number two, generations of new insights. The definition distinctly connect research outcomes to clinical practice, establishing a bridge between theoretical research and practical application. On the other hand, Beck has a more view on our development, professional development. Their definition broadens the scope beyond clinical practice, in which incorporating four key domains. Number one, practice, education, two, third is administration, and the last one is informatics. This multifaceted approach recognizes nursing research as a tool for advancing the profession and not just critical care. There is a understanding in the evolution of the concepts of research. There is a systematic methodology and when it comes to the development. As we can see in the definition of Pollitt and Hagler's basic systematic research to later definition shows an evolutions in research methodology. The concept of systematic inquiry became more sophisticated, incorporating elements of objectivity and scientific rigor. Lara Tablor has a refined definitions that focuses on professional nurses. It defines the definition introduces the concept of phenomena important to nursing, while Neuadomy adds the element of objectivity to this approach. And this shows how the field has moved toward more precise and scientifically rigorous methodology. Integrations of evidence-based practice we can see here in Pollitt and Beck's definitions, wherein it introduces the concept of trustworthy evidence, in which reflecting the growing emphasis on evidence-based practice in nursing research. This additional concept demonstrates the field increasing focus on research in terms of quality and reliability. As a practical applications in clinical, particularly, each definitions contribute to the understanding how research translates into practical nursing care. And there is an emphasis on a systematic approach, ensuring that the research findings can be reliable in clinical setting. We can also see professional development, knowledge generation. As Rosemary Newadomi defines nursing research and explain how nursing research encompasses several key elements. We can see um, the core definition, which is a systematic objective process. One concept in which when we say systematic process, the research follows a structured and organized approach which ensuring the methodological rigor in investigating nursing phenomena. In their definition, we can also say that the analyses are very objective, meaning it emphasizes on the objectivity in terms of the scientific nature of nursing research, in which requiring unbiased examination of evidences and data. The nursing phenomena focuses on each definitions. For example, in newest DOMI uh, texts or books, uh, she outlines several key goals for nursing research. Number one, it promotes evidence-based nursing practice. Number two, it ensures the credibility of nursing profession. It provides also accountability for nursing practice. And the documentation cost is very effective in for nursing care. The framework of Neue Domi emphasizes quantitative and qualitative research integration, and also uh, it projects the systematic steps in the research process. The definition, the books also focuses on the practical application in critical settings. Yes, evidence-based practice are implemented, are highlighted in her works. The nature of research defines research as a systematic process of inquiry to develop or refine knowledge. Research, as its core, is a systematic process of inquiry designed to develop or refine knowledge. This definition encapsulates several key aspects that are very important in nursing for nursing students to understand as we embark the journey of research. For example, systematic nature. A nurse researcher studying the effectiveness of new pain management protocol follows a structured approach. First, they formulate a clear research questions. Second, nagkakaroon ng design of a rigorous methodology of the study. Next, magko-collect na ng data systematically from the patients. For example, after collecting data, there is analyzation by using statistical methods. And from there, the nurse could draw conclusion based on the analysis. Guys, this systematic process ensures the findings are reliable and can be replicated by other researchers. When we say the systematic nature of research, it implies the research follows a structured, organized approach rather than relying on a haphazard observations or personal anecdotes. The nursing research is critical component of our profession, serving as the scientific foundations for evidence-based practice, as I always mention. It is defined as systematic inquiry, investigation of phenomena related to nursing practice, education, and administration. This research is essential for developing knowledge that can improve patient care, also enhances nursing education, and definitely nursing research could optimize health administration. In terms of practice, for example, yung research focuses on developing and refining interventions to promote, prevent illnesses, and manage health problems across the lifespan. For example, a study can be conducted, may investigate new pain management technique and strategies to prevent hospital-acquired infections can also be a point of uh, inquiry, or maybe interventions to improve patients' adherence to treatment plans. So these are samples when it comes to nursing practice. For nursing education, research examine how nurses could learn or develop their skills, informing curriculum development to make a certain modification or program, and teaching methodologies. This might include studies on effectiveness of simulation-based learning, katulad ng ginagawa natin, or inquiry about investigation about strategies to enhance critical thinking skills among nursing students. In When it comes to the nursing administration, research can explore topics such as staffing models, leadership strategies, and even organizational factors that influences patient outcomes. These studies contribute to improving healthcare delivery system and policies. Nursing research employs a variety of methodology that includes quantitative and qualitative approach. Quantitative studies might involve clinical trials or large-scale surveys, while qualitative research could include in-depth interviews or observational studies to understand patient experiences or nursing processes. The impact of nursing research is far-reaching. It provides the evidence base for clinical decision-making, informs health policy at local and national levels. It also contributes to the advancement of nursing as profession. Kapag nag-engage tayo sa research, tayo mga nurses, not only to improve patient's care, but also ni-strengthen niya yung scientific foundation natin sa ating practice. Next is the importance of health research in nursing. It describes how nursing research contributes to evidence-based practice and improved patient outcomes. Nursing research plays significant roles, significant roles, roles that will contribute to the evidence-based practice. And it will improve definitely the patient's outcome. By systematically investigating various aspects of nursing care, research provides a scientific foundation for clinical decision-making and practice improvement. One of the primary ways nursing research contributes to the evidence-based practice is by developing best practices. For instance, a study on a study regarding hand hygiene protocols may lead to the implementations of more effective infections controls measure, significantly reducing hospital acquired infections. This demonstrate how research directly translates into improved patient safety and outcomes. Research also enhances the quality of care by evaluating and refining nursing interventions. For example, studies of pain management techniques have resulted in better post-operative care protocols, thus leading to an improved patient comfort and faster recovery times. By providing evidence for the effectiveness of a specific investigation, research enables nurses to make informed decisions about patient care. Moreover, nursing research informs health policy and healthcare regulations. Studies shows about nurses to patients ratios, for instance, have influenced staffing policies in many healthcare institutions, ultimately affecting patient safety and care quality. This illustrates how research can have a broader impact on healthcare system and practices. In education, research plays a vital role in improving curriculum and teaching methods. Studies on simulation-based learning, for example, have shown its effectiveness in enhancing clinical skills acquisitions among nursing students. This ensures the future nurses are better prepared for clinical practice when we do research, ultimately benefiting patients' care. Research also contributes to cost-effective in healthcare, in which several studies shows on early mobilizations of patients have shown reduced hospital length of stays, and this leads to more efficient use of healthcare resources while improving patients' outcomes. The demonstrations on how research can simultaneously enhances patient care at the same time healthcare system efficiency, the impact of nursing research on patient outcome is significant. A scoping review found out that in this case, where evidence-based practices were implemented, patient outcomes improved about 94% of the time. Next is explain the role of research in advancing nursing as a profession and science. Research plays a crucial role in advancing nursing as both a profession and a science. It serves as the foundation for developing nursing knowledge, improving patient care, enhancing education, and informing policy decisions. By engaging in a rigorous scientific inquiry, we can, as nurses, contribute to the growth and evolutions of our field, ultimately strengthening our profession's standing and improving healthcare outcomes. One of the primary ways research advances nursing is developing and expanding the theoretical foundations of our professions. Kunwari, studies about pain management techniques have led to new nursing theories on patients' comfort, in which providing a more comprehensive understanding on how nurses can effectively address pain across various patient populations. Research also plays a vital role in improving patient care by identifying best practices and innovative inventions. A prime example is a research on early mobilizations of patients, in which, as the study result shows, um, uh, there is a reduced hospital acquisition complication and thereby improves overall outcomes. This evidence has led to changes in nursing practice, emphasizing the importance of getting patients moving as soon as possible after the procedures or during hospital stay. Sa education, research informed curriculum development and teaching methods, wherein several studies shows a study about simulation-based learning have demonstrated its effectiveness in improving clinical skills acquisition among nursing students. And this has led to a widespread adoptions of simulation technologies in different nursing programs or schools, in which better preparing future nurses for a real-world practice. Research also advances nursing practice. How? By providing new nursing roles and responsibilities. Studies shows a supporting a effectiveness of nurse practitioners in their primary care have led to an expanded scope of practice for advanced practice nurses in many jurisdictions. And this allowed them to take on greater responsibilities in patient care. Moreover, nursing research plays a crucial role in informing health policy. A study about nursing staffing ratio have influenced hospital policies and even legislation in some areas. Na kung saan ina-highlight ng mga studies na ito ang impact of adequate nursing staff on patient safety and outcomes. By conducting and applying research, nurses strengthen their professional autonomy and unique contributions to healthcare. Studies demonstrating the impact of nurse-led interventions on patients' outcomes have reinforced the critical role of nurses in the healthcare team, thus supporting the expansion of nursing role. And lastly, research foster innovation, meaning in nursing by driving the development of new technologies and approaches. For example, research has led to the creation of specialized nursing assessment tools, in which this improves the accuracy and efficiency when evaluating our patient. Next is we need to determine what are roles of nurses in research. Because nurses plays diverse and crucial roles in research process, in which contributing significantly to the advancement of healthcare knowledge and practices. These roles span from leading research projects to providing direct care to research participant in wherein each of a of this participant has its uniqueness, responsibility, and challenges. Let's discuss first the role. One of the role is as a principal investigator. It is perhaps the most comprehensive role among nurses is positioning our responsibility in terms of designing, implementing, and analyzing research studies. Um, Nurses can contribute in the expansion of scientific basis of nursing practice by asking clinical relevant questions and developing rigor methodologies to answer them. For example, uh, Nurse Eric might lead to a study investigating the effectiveness of new pain management, for example, in terms of its protocol during post-operative care, wherein it oversees all the aspects of research from conception to dissemination of results. One role is the critical caregivers. In research settings, the clinical caregivers or clinical nurse, should I say, have the unique challenge of balancing study requirements with patient needs. These nurses provided direct care to research participation, administering investigational treatment, monitoring those adverse effects, and collecting research data. For instance, a clinical nurse might be responsible for administering an experimental drug to participants in a clinical trial, while also providing outlines nursing care and monitoring for potential side effects. What about research nurse as coordinators? They focus more heavily on the coordination and management of different aspects of research. They are often responsible for managing subject recruitment, ensuring data integrity, and maintaining compliance with regulatory requirements. A research nurse coordinator might oversee multiple studies simultaneously, at the same time managing the logistical aspect of participation, such as screening of the participants, enrollment, and even during follow-ups across various research projects. Nurse scientists develop, on the other hand, and maintain programs of research, often mentoring other nurses in research methods. These nurses may lead to research items or research teams that will guide the development of research questions and also oversee the implementation of multiple related studies. For instance, a nurse a nurse scientist might lead to a research program investigating various nursing interventions for a particular people who has chronic diseases. So it includes the chronic disease management, mentoring junior researchers, and coordinating multiple interconnected guides. Okay, now let's talk about the ethical responsibilities of nurses involved in research. Nurses involved in research have a significant ethical responsibilities that extend beyond their clinical duties. These responsibilities are crucial for protecting research participants, maintaining the integrity of research process, and upholding the ethical standards of the nursing profession. One of the primary ethical responsibilities is ensuring informed consent. Nurses must ensure that potential participants fully understand the nature of the study, its risks and benefits, and their rights as participants. This involves explaining complex medical concepts in accessible language and verifying comprehensions before obtaining consent. Protecting participants' rights is another critical responsibility. Nurses must respect participants' autonomy, including their right to withdraw from the study at any time without consequences. They must also safeguard participants' privacy and well-being throughout the research process. Maintaining confidentiality is essential in research ethics. Nurses must protect participants' personal information and research data, often using coded identifiers instead of names to maintain anonymity. This responsibility extends to data storage and reporting practices. Minimizing harm is a fundamental ethical principle in research. Nurses must ensure that research procedures do not cause participants unnecessary discomfort or risk. This involves careful monitoring for adverse effects and promptly addressing any issues that arise. Ensuring scientific integrity is also important for the validity and reliability of research. Nurses must conduct research honestly, avoid data manipulations, and report findings accurately, even if the results are not what was expected or desired. Advocating for vulnerable populations is particularly important in nursing research. Nurses must be aware of the special protection needed for participants who may be at higher risk of exploitation, such as children, cognitively impaired individuals, or economically disadvantaged groups. Finally, nurses involved in research often face the challenge of balancing dual roles as caregivers and researchers. They must navigate potential conflicts between these roles, always prioritizing patient care needs over research objectives. Nurses involved in research bear significant ethical responsibilities that are essentials for protecting participants and maintaining research integrity, and also upholding the values of nursing professions. By merely adhering to these ethical principles, nurses contribute to the advancement of healthcare knowledge while ensuring the highest standards of participants' protection and scientific rigor. Nursing research serves multiple crucial purposes that collectively advance the profession and improve healthcare delivery. One of the primary purposes is to develop knowledge. This involves expanding the theoretical and empirical foundation of nursing, which is essential for understanding complex health phenomena. For example, a study investigating the physiological mechanism of pain in cancer patients contributes to the fundamental knowledge base that informs nursing care for oncology patients. Improving practice is another key purpose of nursing research. By conducting rigorous studies on nursing interventions and care strategies, researchers provide evidence for best practices that can be implemented in clinical settings. An example of this is research on the effectiveness of early mobilization in preventing hospital acquired pneumonia, which can directly influence patient care protocols in hospitals. Informing policy is a critical function of nursing research. Studies that examine the impact of healthcare policies or propose evidence based guidelines can significantly influence decision making at institutional and governmental levels. For instance, research on the effects of nurse to patient ratios on patient outcomes has been instrumental in shaping staffing policies in many healthcare institutions. Advancing nursing education is another important purpose. Research in this area helps improve teaching methods and curriculum development, ensuring that future nurses are well prepared for the challenges of modern healthcare. An example is a study on the effectiveness of simulation-based learning in nursing education, in which have led to the widespread adaptations of this teaching method in nursing school. Enhancing outcomes is fundamental goals of nursing research. Studies that identify interventions leading to better health results directly contribute to improving patient care. For example, a research on nurse-led interventions to reduce hospital readmissions for heart failure patients. This has led to the implementation of specialized discharge planning and follow-up care programs. Finally, promoting health equity is an increasingly important purpose of nursing research. Studies focusing on addressing healthcare disparities and improving access to care for underserved populations contribute to the broader goal of achieving equitable health outcomes. An example is research on community nursing interventions to improve health outcomes is undeserved populations, in which can inform strategies for reducing health disparities. Nursing research plays a crucial role in addressing issues relevant to patient care, health promotions, and healthcare delivery. By systematically investigating various aspects of nursing practice and healthcare system, researchers provide evidence-based solutions to improve patient outcomes and enhance the overall quality of healthcare. In the realm of patient care, nursing research directly impacts the way nurses interact with and treat patients. For example, a study on the effectiveness of music therapy in reducing anxiety in ICU patients can lead to the implementation of new interventions that improve patients' comfort and potentially reduce the need for anxiety medications. This type of research addresses the immediate needs of patients and help nurses provide more effective, more personalized care. Health promotion is another critical area where nursing research makes significant contributions. Studies on nurse-led cessation programs is primary in a primary care setting, for instance, can provide evidence for effective strategies to help patients quit smoking. This research not only improves individual patient health, but also contributes to broader public health goals by reducing the prevalence of smoking-related diseases. Research in healthcare delivery focuses on improving the systems and processes through which care is provided. A study on the impact of telenursing on rural healthcare access, for example, can inform policies and practices that extend nursing care to underserved populations. This type of research addresses broader issues of healthcare accessibility and equity. Patient safety is a paramount concern in healthcare, and nursing research plays a vital role in this area. Research on the effectiveness of medication reconciliation protocols in reducing medication errors can lead to the implementation of safer practices across healthcare settings, directly impacting patients' outcomes and reducing adverse events. In the area of chronic disease management, nursing research is crucial for developing effective long-term care strategies. A study-led interventions for improving self-management in diabetes patients can lead to better patients' education programs and support systems, ultimately improving the quality of life for those living with chronic conditions. Mental health is another area where nursing research makes significant contributions. Studies on effectiveness of cognitive behavioral therapy delivered by a psychiatric nurses can expand the role of nurses in mental health care and improve access to effective treatments for patients with mental health disorders. By addressing these diverse areas, nursing research contributes to a comprehensive approach to healthcare improvement. It not only enhances the quality of direct patient care but also informs broader strategies for health promotion and healthcare delivery. This research-driven approach ensures that nursing practice evolves based on the best available evidence, leading to better patient outcomes and more efficient healthcare system. Types of research. We have basic and applied research in nursing. Serves different but complementary purposes in advancing field. Basic research, also known as pure or fundamental research, aims to expand the theoretical and conceptual foundations of nursing science. It is driven by curiosity and the desire to understand underlying principles, often without an immediate practical application in mind. An example is a basic research study in nursing might investigate the physiological mechanism of pain perception in cancer patients. This research would delve into neurological and biochemical processes involved, potentially uncovering new insights about how pain is experienced and processed by the body. While this knowledge may not have an immediate clinical application, it contributes to the broader understanding of pain, which can inform future interventions and treatment. While applied research, on the other hand, focuses on solving specific clinical problems and improving nursing practice. It takes the knowledge generated by basic research and applies it to the real world situations. Applied research in nursing is typically more practical and solution oriented, with a clear focus on improving patient or healthcare delivery. An example of applied research in nursing would be evaluating the effectiveness of a new pain management protocol in postoperative care. This study would directly address a clinical issues, potentially leading to improved pain control for patients recovering from surgery. The results of such research could be immediately applicable in healthcare setting, influencing nursing practice and patient outcomes. The time frame for this type of research also differs. Basic research often requires longer period to develop and test theories, while applied research typically has shorter timelines aiming to address current clinical needs. In terms of applicability, basic research findings are often broad and generalized, contributing to the overall body of nursing knowledge. Applied research results, however, are usually specific to particular clinical situations or populations, offering targeted solutions to defined problems. But both types of research are crucial for the advancement of nursing as a profession and science. Basic research provides a fundamental knowledge that applied research builds upon, while applied research translates theoretical concepts into practical improvements in patient care. Together, they form a continuum of inquiry that drives innovation and excellence in nursing practice. What about common types of nursing research? Nursing research encompasses various types of scientific inquiry, each addressing different aspects of nursing profession and healthcare delivery. The three main types of nursing research are clinical research, educational research, and health system research. The clinical research is in nursing focuses on improving patient care, developing and testing interventions, and enhancing health outcomes. This type of research forms the scientific basis for nursing practice and directly impacts patient care. For example, a clinical research study might evaluate the effectiveness of a new pain management protocols in postoperative care. Such research can lead to improved pain control for patients recovering from surgery, directly influencing nursing practice and patient outcomes. The educational research in nursing examines the methods and strategies to prepare future nurses and enhance the skills of practicing nurses. This type of research is crucial for improving the quality of nursing education and ensuring that nurses are well prepared for the challenges of modern healthcare. An example of educational research might be a study on the effectiveness of simulation based learning in improving clinical skills acquisition among nursing students. The results of such research can inform curriculum development and teaching practices in nursing schools. Health system research in nursing investigates broader issues related to healthcare delivery, organizations, and policy. This type of research often examines how the structure and processes of healthcare system influence the quality, cost, and accessibility of care. For instance, a health systems research study might explore the impact of nurse to patient ratios on patient outcomes and healthcare quality. The findings from such research can inform healthcare policies and practices, potentially leading to improvements in overall healthcare delivery. These different types of nursing research complement each other, collectively contributing to the advancement of nursing as a profession and science. And now let's proceed discussing the different types of research. There are four main categories of research classification. Number one is according to the purpose or objectives. These are the basic or pure research. Basic or pure research focuses on expanding fundamental knowledge in the field without immediate practical applications. This type of research aims to understand underlying principles, develop theories, and discovering new concepts. For example, studying cellular mechanisms or theoretical physics concepts represents basic research that may not have immediate real-world applications, but builds the foundations for future discoveries. While applied research takes existing knowledge and theories and implements them to solve specific problems or improve processes. And this type of research has direct practical applications and often addresses immediate challenges in various fields. For instance, developing a new drug treatment or creating more efficient manufacturing processes. In terms of scope or coverage, we have action research and the evidence-based practice. Action research represents a unique approach where practitioners study their own professional practice to improve it. This type of research is particularly valuable in education, healthcare, and organizational development, where professionals can systematically analyze and enhance their methods and outcomes through continuous reflections and adjustment. While evidence-based practice research combines three key elements: the research evidence, clinical expertise, and patients' preferences. This approach ensures that decisions are made based on their best available scientific evidence while considering practical expertise and individual circumstances. It's particularly prominent in healthcare and other professional fields. In terms of design, as type of research, we have quantitative research and qualitative research. Quantitative research employs mathematical and statistical methods to analyze numerical data. This approach allows researchers to test hypotheses, identify patterns, and make generalizations about larger populations. It typically involves structured data collections, methods like survey, experiments, and statistical analysis. While qualitative research explores complex phenomena through non-numerical data such as interview, observations, and case studies. This approach helps understand human behavior, social dynamics, and individual experiences in depth, providing rich, detailed descriptions of phenomena. In terms of time dimension, we have cross-sectional research and longitudinal research. Cross-sectional research captures data at a specific point in time, providing a snapshot of population or phenomenon. This approach is useful for understanding current conditions, prevalence rates, or relationship between variables at a particular moment. On the other hand, longitudinal research or studies track changes over time by collecting data from the same subjects repeatedly. And this approach helps understand developmental trends, cause and effects relationships, and patterns of change over extended periods. And we have also prospective research and the retrospective research under time dimension. Prospective studies follow subjects forward in time, collecting data as an event unfolds. This approach is particularly valuable for understanding cause and effect relationship and predicting outcome based on initial condition or interventions. While the retrospective research examine past events or conditions by looking backward in time. This approach is useful for understanding historical trends, analyzing past outcomes, and identifying potential risk factors or causes of current conditions. There are key relationships among these categories. Number one is methodological integrations, wherein quantitative and qualitative designs can be used in both basic and applied research. Evidence-based practice often combines multiple research approaches. We can consider also the time dimension. It is temporal. The time dimension choices affect both scope and design decisions. Cross-sectional and longitudinal studies can employ either quantitative or qualitative methods. This type of research also has practical applications. Action research and evidence-based practice focus on practical implementations, while basic research informs applied research, creating a knowledge continuum. Let's dive in more, comparing the quantitative research versus qualitative research. And these two approaches, research approaches, serve different but complementary purposes in nursing research. Quantitative research focuses on testing hypotheses and identifying causal relationship and generating generalizable findings. It employs a deductive approach, starting with the theory or hypothesis and collecting numerical data to test it. For example, a quantitative study might evaluate the effectiveness of a new pain management protocol in postoperative care by measuring pain scores and medication usage across a large sample of patients. In contrast, qualitative research aims to explore and understand phenomena in depth, develop theories, and provide rich description of experiences. It uses as inductive approach, gathering detailed information from smaller number of participants to generate insights and theories. An example of qualitative research would be exploring the lived experiences of nurses caring for COVID-19 patients through in-depth interviews. The data collection methods differ significantly between the two approaches. Quantitative research typically uses structured methods such as surveys, experiments, and clinical trials to collect numerical data from large, randomly selected samples. And this allows for statistical analysis and generalization of findings to broader populations. While qualitative research, on the other hand, employs methods like interviews, focus groups, and observations to gather textual or visual data from smaller, purposely selected samples. Analysis techniques also vary between the two approaches. Quantitative data is analyzed using statistical methods to test hypotheses and identify relationship between variables, while qualitative data undergoes thematic or content analysis to identify patterns, themes, and meaning within the rich descriptive data collected. The outcome of these research approaches serve different purposes in advancing nursing knowledge and practice. Quantitative research produces generalizable findings that can inform evidence-based practice guidelines and policy decisions. On the other hand, qualitative research provides an in-depth understanding of complex phenomena, patient experiences, and contextual factors that influence health outcomes. Both approaches have their strengths and limitations. Quantitative research offers precision and generalizability but may miss nuanced context factors, while qualitative research provides rich, detailed insights but may be limited in generalizability. Many researchers advocate for mixed methods. This mixed methods approach that combines both quantitative and qualitative elements to provide a more comprehensive understanding of a complex health issues. How are we going to appropriately use quantitative and qualitative methodologies in nursing research? The quantitative and qualitative methodologies serve indifferent but complementary purposes in nursing research. Each approach is suited for answering specific type of research questions and providing unique insights into nursing practice and patient care. Quantitative methodologies are appropriate when the research aims to measure outcomes, test hypotheses, or establish relationship between variables. For example, a study examining the effect of a new pain management protocol on postoperative pain scores would use quantitative methods to collect numerical data and analyze it statistically. This approach allows researchers to quantify the impact of the intervention and potentially generalize the findings to broader populations. Qualitative methodologies, on the other hand, are ideal for exploring experiences, perceptions, and meanings, as well as generating theories. A study investigating nurses' experiences of caring for COVID-19 patients would benefit from a qualitative approach because allowing researchers to capture the complexity and depth of nurses' lived experiences through in-depth interviews or focus groups. For large-scale population studies or epidemiological research, quantitative methods are typically more appropriate. For example, a survey on diabetes prevalence among adults in a specific region would use quantitative techniques to collect and analyze data from a larger sample, providing statistical insights into the scope of a health issue. When the research aims to explore complex phenomena or cultural and contextual factors, qualitative methods are often more suitable. The ethnographic study of end-of-life care practices in different cultural settings would use wo- would use qualitative techniques to provide rich, detailed descriptions of how cultural factors influence care delivery and patient experiences. Evaluating the effectiveness of interventions often calls for quantitative methodologies. For example, a randomized controlled trial comparing two different wound dressing techniques would use quantitative methods to measure outcomes and determine which techniques is more effective based on objective criteria. To understand patients' perspective and preferences, qualitative methodologies are particularly valuable. A phenomenological study of patients' experiences with chronic pain management would use qualitative methods to gain deep insights into how patients perceive their care and what factors influence their experiences. In many cases, a mixed methods approach combining both quantitative and qualitative methods can provide a more comprehensive understanding of complex nursing issues. This approach allows researchers to both measure outcomes quantitatively and explore the underlying reasons and context qualitatively, leading to a richer and more nuanced understanding of the research topic. And now we have here the steps in research process, quantitative and qualitative. Quantitative research follows a structured, linear process that begins with problem identifications and ends with the disseminations of findings. The first steps involves defining the research problems and formulating clear, measurable research questions. This is followed by a comprehensive literature review to understand existing knowledge and identify gaps in the field. Based on the literature review and research questions, researchers develop testable hypotheses. The next crucial step is selecting an appropriate research design, such as experimental or survey methods that aligns with the research objectives. Operationalization involves defining and measuring the variable of interest. This is followed by sampling, where researchers choose a method to select participants and determine the appropriate sample size for statistical analysis. Data collection is a critical phase where research gather information using predetermined instruments. Once collected, the data is processed, which involves cleaning and coding to prepare it for analysis. Data analysis employs various statistical techniques to test hypotheses and identify significant relationships of or differences. The results are then interpreted in the context of research questions and existing literature. Finally, the findings are disseminated through research reports, academic publications, or presentations to contribute to the body of the knowledge in the field. And this systematic approach ensures that quantitative research is conducted rigorously, producing a reliable and valid results that can be generated to broader populations. Remember that each step builds upon the previous one, creating a logical flow from the initial research questions to the final conclusion and implications of the study. We have key phases of qualitative research process. The qualitative research process involves several interconnected phases, each crucial for developing a deep understanding of the phenomenon under study. The data collection phase is the foundation of qualitative research. Researchers gather rich, descriptive data using methods such as interview, focus groups, observations, or document analysis. For example, a study exploring nurses' experiences in caring for COVID-19 patients might involve in-depth interviews with healthcare professionals. Once data is collected, the next phase involves organizing and preparing for analysis. This typically includes transcribing interviews, organizing field notes, and ensuring all data is in a format conducive to analysis. The data analysis phase is a critical and often iterative process in qualitative research. It involves examining the data closely to identify patterns, themes, and relationships. Many researchers use a process called coding, where they assign labels or codes to segment of data that represents important concepts. For instance, in the COVID-19 nursing study, codes might include emotional stress, resource challenges, or coping strategies. Data interpretations follows analysis and involves making sense of the coded data and exploring the relationship between themes. Researchers critically examine the data, compare different codes, and identify overarching themes and connections. In our example, the researcher might interpret how emotional stress relates to coping strategies used by nurses. And the final phase is reporting, where researchers present their findings and conclusions in a coherent narrative. This often involves using direct quotations from participants to support the themes and interpretations, ensuring that the participants' voices are accurately represented. It is important to note that while these spaces are represented linearly, qualitative research is often an iterative process. Researchers may move back and forth between phases as new insights emerge, constantly refining their understanding of the data. So, according to the book of Dr. Alice Wag, we have several steps in research process for quantitative and qualitative. For quantitative, we select a topic. This topic selections journey begins and a critical phase requiring careful consideration of feasibility, relevance, and researcher expertise. A well-chosen topic addresses a significant knowledge gaps while remaining manageable within available resources and time constraints. The topic must align with the researcher's capabilities and academic or professional interests. Literature review phase. The following topic selections, researchers conduct a comprehensive literature review using annotated bibliography techniques. This systematic examination of existing research serves multiple purposes. It identifies theoretical foundations. It reveals knowledge gaps. It establishes research context, and it prevents duplication for existing work. Steps 3 and 4 is about research framework development, variable identification, and titling. This phase involves precise identifications of research variables and crafting an appropriate title. The process requires clear distinctions between independent and dependent variables, understanding of variable relationships, development of title that accurately reflects the research scope, and consideration of variable operationalization. Write the introduction. This is the introduction development. The introduction provides essential context and background, establishing the study's significance within its field. This section must present relevant background information, establish research context, demonstrate study significance, and connect to broader academic discourse. Step 5 to Step 7 is about problem finalization. The research problem statement requires precise articulations that clearly defines the issues, that establishes scope boundaries, that demonstrates practical or theoretical relevance, and that provides directions for subsequent research steps. In research focus refinement, within steps 5 and 7 to 7, it also develops the includes development of research questions. Research questions guide the entire study methodology and design. Effective questions must be clear and answerable. It must be aligned with research objectives. It must be appropriate in scope, and it must be logically connected to the problem statement. We have also the hypothesis formation. And this is the final step, involves developing testable predictions that connect directly to the research questions. Attestable predictions that draw from theoretical foundations and that state relationship clearly. The prediction must guide data collection and analysis method. Methodological integration also involves in these steps. And these 7 steps create a systematic progressions from broad concepts to specific research elements that will ensure logical development of research ideas, that will ensure clear connection between components, ensure systematic documentation, and ensuring there's a rigor in methodology. And the process maintains flexibility while ensuring comprehensive research development applicable across various research paradigms and methodologies. Step 8 to step 11 is about theoretical foundation step. It involves theoretical paradigm. The theoretical paradigm serves as the philosophical foundations of research, encompassing fundamental beliefs about how knowledge is created and understood. It guides methodological choices and shapes the researcher's approach to investigation, whether positivist, interpretative, or critical theory based. Theoretical background or framework involves a comprehensive analysis of existing theories and research relevant to the study. It synthesizes previous findings, establishes theoretical foundations, and positions the current research within the broader academic discourse. The framework provides scientific legitimacy and helps identify knowledge gaps. Conceptual paradigm. This is the visual representation of theoretical relationships, helps researcher map complex interaction between variables. This model illustrates the study's theoretical structure, showing how different components interact and influence each other within a research context. The conceptual framework, this framework translates theoretical concepts into operational terms, showing how variables will be measured and analyzed. It provides a practical roadmap for implementing the research design and collecting data. The steps 12 to 13 is about research value and boundaries. This includes significance of the study. And in this section articulates the research potential impact on theory and practice. It explains how findings might benefit various stakeholders and contribute to the field's knowledge base, justifying the investment of time and resources. The scope and limitations also includes in this phase, wherein clearly defined boundaries help manage expectations and ensure research feasibility. This step acknowledges constraint while maintaining scientific rigor within established parameters. And steps 14 to 16 is about clarity and ethics. We have definition of terms. Precise operational definitions ensure a consistent understanding of key concepts across study. This clarity is crucial for reliability and validity in research implementation. The ethics consideration permeate all aspects of research that ensures protection of our participant rights, ensure the data integrity, ensure responsible research conduct, and ensures compliance with ethical guidelines. And making of informed consent is the final step protects participants' rights through clear communication of research purposes, documentations of voluntary participations, explanations of potential risks and benefits, protection of participant privacy. Integration in research process of these steps has created a comprehensive framework that establishes theoretical foundations, ensures methodological rigor, maintains ethical standards, protects participant rights, and facilitates clear communications of research. And we can observe the progression from these theoretical concepts to practical implementations that ensure systematic and ethical research conduct while maintaining scientific validity. How to write chapter 2 for quantitative. Initial organization phase is the first one, wherein the first two steps establishes the foundation of structure of research. Step 1 involves constructing a comprehensive topic outline that serves as a blueprint for the entire chapter. This flows naturally into steps 2, where research questions are strategically integrated into the outline, ensuring alignment between the investigation's goals and its structure. Information gathering phase, which involves the step 3 and step 4. And this focus on the collection of quality research materials. The process begins with systematic Google searching to gather irrelevant information, followed by a critical evaluation phase where only reliable and current studies are selected. And current studies should be 5 years from now. This careful curation ensures the research is built on credible foundation. The step 5 uh, represents the intellectual core of the process through synthesis. Here, the researcher must compare and contrast different sources, identify patterns and relationships, develop new insights from existing literatures, and create coherent arguments from diverse sources. Documentation phase includes this is the final steps wherein it involves the technical aspect of research writing, wherein focusing on proper paraphrasing and APA formatting. These steps ensure academic integrity through proper attribution, consistency in citation style, clear distinction between original source and ideas, and professional presentation of research findings. These 6 steps create a systematic approach to research writing that maintains logical progressions, ensure academic rigor, promote clear organization, and facilitate effective knowledge synthesis. Now, what are the research methodology steps in Chapter 3? Steps 1 to 4 is about research design foundation. The methodology begins with a comprehensive research design description, establishing the study's structural framework. This flows into defining inclusion criteria that specify participants' characteristics and the study boundaries. The sampling method selection follows, determining how participants will be chosen, which leads to creating a detailed subject selection flowchart that visualizes the participant recruitment process. Study environment and data collection are within steps 5 and 6. The study setting description provides context for where the research will take place, considering environmental factors that might influence the results. This connects directly to data collection methods and outlining specific techniques and procedures for gathering information. For step 7 to 10, this pertains to data analysis and quality control. Statistical treatment outlines the mathematical and analytical approaches for data interpretation. Instrumentation details the tools and measures used for data collection. The control of extraneous variables and elimination of bias work together to ensure research validity and reliability. Next is implementation. This implementation management ay makikita on steps 11 to 12. This is the final phase wherein it focuses on practical execution. Research assistant preparation. Why? Because we have a comprehensive orientation programs when we have this research assistant. And this research assistant must undergo specific training protocols if we need, with clear role definitions. And it measures quality control. If the project timeline management is necessary, and we call it Gantt chart, no? This provides visual project timeline and also provide task scheduling and resource allocations and also provide progress tracking and milestone identifications. These 12 steps create a systematic approach for this writing chapter theme, and this ensures methodological rigor, maintains research quality, facilitates clear documentation, promotes efficient uh, execution, and supports both qualitative and qualitative approaches. Chapter 4 Research Writing Process. It involves 6 steps: data organization and analysis phase, wherein the research process begins with data collations, where researchers systematically gathered and organize all collected information. This flows directly into statistical treatment and analysis, where appropriate statistical methods are applied to transform raw data into meaningful insights. These first two steps create the foundations for all subsequent analyses. And now we have the data presentation phase, wherein the third steps involves creating clear tabular presentation of the analyzed data. This crucial step transforms complex numerical or qualitative data into easily digestible formats, making patterns and relationship more apparent. Table, charts, and other visual representation serves as a powerful tool for communicating research findings. And last is analysis and discussion phase. Steps 4 and 5 form the analytical core of the research. When writing analysis, it should be detailed examinations of data patterns. Analysis identifies the significant findings, and it connects the results of research questions. There is a connection of this analysis to the results of research questions. And writing analysis includes systematic presentation of evidences. While discussing the results, it should be contextualization of findings, and there should be a comparison with existing literature, or it explains patterns and trends, and of course, addressing research objectives. When in the interpretation phase rather, the final steps involves interpreting the results where researchers draw meaningful conclusions. It connects findings to theoretical frameworks, it identifies practical implications, and this final step suggests future research direction. These 6 steps create a systematic approach that again ensures logical progressions from data to insights, clear communications of findings, and rigorous analysis of results, and meaningful interpretation of outcomes. The process works effectively for both quantitative and qualitative research when writing chapter 4, though the specific techniques may vary based on the research methodology or institutional policies. Each step builds upon the previous ones, creating a comprehensive framework for research writing. Research writing chapter 5. This involves summary development for step 1, wherein the research writing process begins with crafting a comprehensive summary that distills the entire research into its essential elements. This summary captures the key findings, methodology, and significance of the study while maintaining clarity and concisement. Conclusion formation deals entails our step 2. The conclusion synthesizes the research findings and their implications. And this step requires careful analysis of results and their relationship to research objectives, creating a coherent narrative that ties together all elements of the study. Step 3 is the recommendation development. Based on the research findings, specific recommendations are formulated to address practical applications of findings, future research direction, solutions to identify problems, and implementation strategies. For steps 4 to 5, this pertains to documentation and abstract creation. These steps involves organizing references systematically, creating a comprehensive bibliography, crafting a concise abstract that captures the entire research, and ensuring proper citation format. Next is step 6, which is the practical application. And in these steps, focuses on translating research findings into real-world applications, wherein we identify practical implementations, develops action plans, creating guidelines for practitioners, and establishing implementation frameworks. In step 7 is the IMRAD presentation. This final step involves preparing a structured presentation following the IMRAD format. I. Introduction. M. Methods. R. Results. A. Analysis. And D. Discussion. These 7 steps create a systematic approach to research writing that ensures logical flow of informations, clear communication of findings, practical application of results, and a professional presentation of research that is comprehensively documented the study. And this process maintains academic rigor while making research findings accessible and applicable for both academic and practical contexts. And now for qualitative design research steps. Initial steps, research foundation for step 1 to 3. The research process begins with three fundamental steps that establishes the research direction. Topical selection serves as the entry point, requiring careful considerations of research interest and feasibility. This is followed by reviewing non-substantive literature, which provides background, understanding, and contextual framework. The third step involves identifying the phenomenon, which defines the specific focus of inquiry and establishes the research boundaries. Research context developments is are the steps 4 to 6. This middle phase focuses on establishing the research framework through three critical steps. First is writing the introductions that sets the stage for the entire study, providing context and background. Second, stating the research problem purpose that clarifies the specific issues to be addressed. And last is discussing the theoretical framework that establishes the philosophical and conceptual foundation that will guide the research. The theoretical framework integration or the philosophical underpinning serve as the conceptual backbone of the study, wherein it provides interpretative lens for data analysis or philosophical foundations for methodology and conceptual structure for understanding phenomena. Steps 7 to 8 refers to the research parameters. For final phase of qualitative manuscript, this establishes the research boundaries. Significance of study includes here. This establishes research value. The significance of study identifies potential contributions, and justifies research importance. And lastly, significance of study links to broader academic discourse. While scope and limitations define defines research boundaries, it acknowledges constraints, set realistic expectations, and clarifies study parameters. This systematic approach ensures a well-structured, qualitative research design that maintains academic rigor while providing clear directions for research process. And each step builds upon previous one, creating a cohesive research framework that guides the entire study. Listen to this because we have different chapters for qualitative, numbers of chapters. In when speaking of literature review in qualitative research, there is the process wherein we synthesize the theoretical uh, uh, literature review. This theoretical sensitization process involves literature review when doing your qualitative research and serves as a guiding framework rather than a rigid structure. It helps researchers develop theoretical sensitivity while remaining open to emerging themes and patterns from the data. And this theoretical sensitization process allow discovery of new insights, recognition of patterns, understanding of contextual factors, and development of initial conceptual frameworks. In literature review, there is a multiple perspective integration. The review process emphasizes diverse theoretical viewpoints. It emphasizes also various methodological approaches, different cultural perspective, and emphasizing alternative interpretations of phenomena. The methodology development aspect is something to do with each approach justification. The methodology for qualitative chapter carefully explains the choice of qualitative tradition. It outlines philosophical underpinnings. It shows research paradigm alignment and the methodological fit with research questions. What are the roles of researchers uh, in this qualitative process? Special attention is given to research positionality or potential biases are considered and personal experiences are also considered. Special attention also is given to relationship to the research topic. For data and collection analysis, there is the source of diversity, wherein qualitative research employs multiple data sources. There is the primary sources, which is the interviews or observations, secondary sources coming from documents or artifacts, digital sources or through online interactions, and also it can be cultural materials. Here we have to measure the quality assurance, wherein the qualitative researcher maintains rigor through triangulations of data sources. Member checking procedures. There is also audit trail maintenance and thick description of development. Writing qualitative research results and discussion process. Steps 1 to 2, it's about raw data management. In qualitative research, the organization and analysis of raw data involves transcriptions of interviews and field notes, coding of textual data for themes and patterns. It also involves organization of artifacts and visual materials and, if necessary, development of thick descriptions and identifications of emerging categories is important. Steps 3 to 4 is about data presentation. The presentation phase in qualitative research emphasizes rich narrative description and participant voices through direct quotes. It also emphasizes thematic analysis presentation, and visual representation of conceptual relationship, and of course, the contextual interpretations of findings. The concluding elements in qualitative research involves summary development and conclusion formations and recommendations. In summary development for qualitative summary, this focuses on holistic interpretation of findings, also integration of multiple data sources, and it focuses on emergence of patterns and themes, connections to lived experiences, and cultural contextual consideration. Conclusion formations for qualitative uh, conclusions emphasizes the interpretations of meaning and understanding of phenomena. It also emphasizes connection to theoretical framework, recognition of multiple realities, and reflexive analysis. Recommendations for qualitative typically addresses practical application in a specific context, and also addresses suggestions for deeper understanding and future research directions, implementations, considerations, and finally, knowledge transfer strategies. This qualitative approach maintains focus on depth, meaning, and interpretation throughout the results and conclusion phases, that emphasizing the importance of context and multiple perspective in understanding such complex phenomena.